Everybody drinks. Everybody goes to pubs, and you don't tell them that, do you?
I do. I tell everybody.
I am not a moron, and I don't like being treated like I've got half a brain. I haven't got half a brain, I've got a whole brain, and it functions beautifully.
There, that's where your penis is. That's where you breathe from, and that's where Dr. is showing you.
Exactly.
Oh, dear.
This is just this morning.
I've got liver cancer, not brain cancer. You know, I can still function, and I want to do that. Every day's precious.
Good morning, Putney Mead, Iris speaking.
Yeah. I'm just trying to see who else does it.
And your name?
Who else does that thing for you? I'm trying to see which other doctor does it.
Hello. Sorry, I've kept you waiting too long.
It's all right.
How are things?
It's peculiar what happened. I was stung on my arm by a wasp that came in through the window.
OK. So when was this?
It was a couple of days ago. I couldn't move my arm. It swelled up, and then it felt achy all the time. It's still funny, my arm. I don't know whether it's because I'm a funny woman.
Do you want to show me where the wasp stung you? Do you want a hand? There we go. You got that one?
It sort of swelled up there, and it still prickles or something and aches.
Well, nothing's hot or red or angry.
It aches still.
Now, what's happening with the psoriasis? Have you been going to see the dermatology nurses?
I haven't because I've been too busy.
Because they were supposed to see you, weren't they, in the daycare so that they could do your creams for you. It's still quite bad on your elbows, isn't it?
It will go. It doesn't hurt.
What's stopping you from going to see the nurses?
It's because I'm tired. I get tired. I can't sleep at night. I lie awake. We're moving.
Yeah.
And it's awful.
What's happening with your sister?
She's going to the country.
OK.
Retirement home.
And have you found anywhere that you're going to live?
No, I can't find anywhere.
As GPs, we're always taught that we should ask open questions and let patients tell their story, but it can be really difficult when patients bombard you with lots of different pieces of information at once. In a 10-minute consultation, that's really difficult.
So are you wanting to buy something then?
I want to buy a flat for the rest of my life. I'll be on my own with my cat, that's all. My sister doesn't want me anymore.
Oh. So did you ever think about going with her, or do you want to stay in Putney?
I want to be near Morley College, where I give concerts and I play Beethoven, Chopin, Brahms, Rachmaninoff. And I played all my life since I was 5 years old.
OK.
Music keeps you young. It kept me young. My father died of a heart attack in the hospital. I just visited him and he said, good luck for your concert. And it was sad, really.
No, it is.
He said, be happy when you play. And he smiled, that's all.
I'm falling apart, basically.
Right. Oh dear, okay.
The last 4 or 5 days, I think I had an ear infection. My ear was agony.
Right.
And also, I would like you to look up to see what progress they're making towards this hernia.
Right.
And the large cyst I found, and I've had enough.
Yeah.
Do you mind if I have a good look at all the joints on each side?
No, have a look at everything.
Pain when I'm pushing?
Yeah.
Up and down, does that cause pain? Okay.
Yeah.
Bet they fractured the bone in my groin
When?
when they done the angiogram.
Okay. All right. Where do we start?
You have to go in soon.
What?
You know, the doctor's going to look at your ear.
Okay.
Are you going to be a good boy and let him look?
Okay.
Are you going to be a good boy?
Yeah.
Hello.
Hello.
Yeah.
How are you?
I'm well, thank you.
Hey, Mommy.
Hello, Matthew.
Hi.
When did I see you last? That was a while ago.
Hey.
It was
It is a
quite
while
like
ago.
10. More like 10.
Yeah, 12 now already. He has got another ear infection, and I only noticed it yesterday evening when we were in church that he had a lot of gunk coming out of his ear. He won't let me touch it.
Right.
He insists that it doesn't hurt, but he quite often does that. I've never been able to be sure whether he's just got a very high pain threshold or whether his communication's a bit off around it.
Cough, cold, snuffly nose.
He's been very tired, but no, not really. No. And
Fever?
it's quite difficult with Matthew because he doesn't tend to develop particularly high temperatures.
No.
And quite often, you know, it's only when you see the evidence of something. I imagine this has probably been quite uncomfortable for him for some time, but it's only seems to be when there's some visible sign.
Can I just have a little look at your ear?
Yeah.
It's a bit of a mess, isn't it? You can't see it, though, can you?
He won't let me clean it or anything.
Can I just touch it with a stick?
Hi.
Yeah, not going to go inside, just on the outside. Get a little bit of that fluid. You look at Mummy for me.
Matthew, look at me.
That's good boy.
Look at me.
Ow, ow, ow.
Good boy, good boy, good boy, good boy, good boy, good boy. Ah, good boy.
Well done. Good boy, Matthew.
I like your jacket, Teresa.
Oh, do you? Well, you're not having it. I'm joking. I've seen you for a while.
No, we haven't. Have you been well this early?
Yeah, but did you like to get fun
So
one
yesterday, I read this. It really frightened me when I read it.
Oh, really? OK, well, we can talk about that. With this, what scared you about it?
It scared you about people dying, you know, not surviving the operation and that.
Yeah. OK. Did you understand what it's talking about, this
Yeah.
aortic aneurysm? Yeah. What did you understand by it?
Well, because my father had one.
Did he? You said your dad had a problem with one, did he?
Yeah, because he had the operation, and 2 weeks after he died.
Did he?
Because he had a blood clot. Do you know if I've got one?
Hi. Oh my goodness. You have got a really big buggy, haven't you? Yeah.
Does the airways sound quite tight? Oh dear. Life is hard, isn't it?
All right, okay, all right, dude. Okay, cool. Oh.
Can I just pop this in your ear and take your temperature?
Did you hold your hand quickly?
Just, whoopsie. Oh, dear.
Oh, dear.
It's all right.
Poor old you.
Come on, Bubba,
You got your hands full, haven't you?
Absolutely.
Do you want to just give him a cuddle and then I'll just have a look at it?
Come on, Bubba. Come on, sweetie.
Hi, how can I help today?
So we just need to get a certificate of health from his modelling agency.
Let's have a look. She's going to be a superstar, is he?
It's nice to see a well baby. I see lots of time seeing grizzly babies.
Now, we'll have to ask at the desk whether or not sometimes these things don't technically come under NHS services and sometimes there's a fee.
Oh, yeah. No,
but I'll ask. Can I have a look at your tummy? Lovely. We'll just give you a little once over. Oh, let's have a little listen to your heart. Good boy. Look in your mouth. Good boy. Thank you.
Very good.
Magic. Magic. So what I'll do is, I've got no reason to be concerned at all. I will sign this and I will just put it in an envelope and ask you to speak to Nicola, who's currently on reception.
Okay.
Good luck with his stellar career.
Thank you.
Are you still smoking?
I still smoke consulate, cool as a mountain stream.
How many a day?
About 10.
Okay. Any thoughts about quitting?
What?
Do you want to stop?
Watch what?
Do you want to stop smoking?
Not particularly at the moment, I'm worried.
I mean, it may not be the right time for you to stop smoking now, but I think it would be important to do it when things are more settled. What about alcohol? Because alcohol can increase your risk of osteoporosis.
I'm trying to cut down.
That would be really important if you try and cut it down so that you're having less than 14
My sister, we
units.
both try and have half a bottle each.
Over what period of time?
On a night.
Half a bottle a night?
We have little small glasses. We fill, and she goes back again and fills.
But if you're having half a bottle every night, that's much
No,
more than...
she has her bottle. I have mine. They are small ones.
OK, but even if you're having... What, do you have the whole bottle?
No, we don't drink... No, we have she has a small glass and she fills it about that full.
Right.
Full.
What we recommend is that you don't have more than a bottle, if you're drinking wine, a bottle and a half a week.
Oh, everybody drinks. Everybody goes to pubs and you don't tell them that, do you?
I do. I tell everybody that they need to not drink more than the recommended amount. The other thing that you need to do is make sure that you're getting enough vitamin D and calcium in your diet.
Oh, I expect you're hungry, aren't you? Have you had your lunch?
I haven't, no. I've been busy.
Oh. Well, you must come to my flat when I buy a modern flat in Putney and have a meal. I'll cook for you.
Thank you.
Spicy cheese grilled.
OK.
And you put tomato puree, a bit of that, and you make an ordinary tasty thing, and you put few herbs in it, and then you grill it, the top of it.
Sounds good.
And put a gherkin on top.
OK. Right. The things that I'm going to do is, why don't we see each other in a few weeks, OK? And then you go and see the dermatologist tomorrow about the skin, OK?
Yeah. I better go.
All right.
Thank you very much.
And that's your time of the appointment, remember? So you take that. All right, so you go and see them tomorrow.
Thank you.
See you later.
What do doctors do when they, finish at 12 but then start again at 5?
They either go home if they live close, or they do paperwork, like catch-up work.
This is Dr. Hassas from Putney Mead Surgery. Hi there, I had a message to give you a call, sir.
The work is endless.
I was expecting to see you this morning, I think, to check your blood pressure.
When we've finished seeing our patients, we've then got to type our own referrals, read all the letters coming back from the hospital. We need to check blood results, review people's repeat medications. The list is just goes on and on and on, and you never feel like you get to the end of your work.
Well, when did all the trouble start?
I tried to ring you yesterday, but you were unwell.
Just give me an idea how long this has been going on for.
Right.
Give me a rough idea.
OK, take care. Bye.
Yes.
So they haven't written to you because you've got one. They've written to you and thousands of other men of your age to see if you've got one. Did you understand what it's talking about, this aortic aneurysm?
No.
No. What we'll do, why don't we draw a picture. So, if my drawing's very bad, all right, that's your body. Okay, it's not a very good drawing. But your heart is here.
I think that's your legs, Richard.
Brilliant, well done.
And there,
Yeah.
there, that's where your penis is. That's where you breathe from, and that's where Dr. Owen's showing you.
Exactly, exactly. So, this bit here is called the aorta. And normally it's nice and straight like that, like a railway track. Sometimes it can swell up a bit like an orange, and it bulges out. And this is what is called an aortic aneurysm. What they've done is they've written to you to get you to have a scan that just looks at your aorta in your tummy. So it's not saying that you've got an aneurysm. It's not saying that you need an operation for it. You said your dad had a problem with one, did he?
Yeah, because he had the operation, and 2 weeks after he died.
Did he?
Because he had a blood clot on the heart.
Okay.
Yeah.
He had an operation on an aneurysm, did he? Did he? Okay. But just because he...
But he had a blood clot there.
Did he? Yeah.
So...
Yeah. After operation, sometimes people can get blood clots, unfortunately. But just because he had it, it doesn't mean you've got it. Richland trees, they have different needs from a lot of our population. From my point of view, I see my role as helping them negotiate the health service in order to use it effectively. Richard, they're not going to do any operations on you. What they're talking about doing is putting some jelly on and having a look. You know when pregnant women have their babies looked at?
I'll be with you.
Oh, is it the same thing?
It is, yeah.
Oh, right.
It's what's called an ultrasound scan. Okay.
It's
Pressure
got
off
nothing to
that
do with
area.
your stomach, is it?
No, it's nothing to do with your tummy being big. Okay. Sometimes, if you're very thin, we can feel them, but I think you're a bit too big for us to feel it. I can try and feel it if you like, but it's quite hard to. If you've got a bit of fat on your tummy, we often can't feel it.
Doctor, don't say that. He's trying to lose a lot of weight, is he not, son?
I'm not overweight. No, he says, look, he's laughing.
I'm not laughing at you. But you know your tummy's bigger than mine, isn't it?
Yeah, but it's not that...
He does go to the gym a lot.
That's really good. And going to the gym helps stop things like this. Yeah, that's really helpful.
Can we give you some medicine?
Yeah.
You sure?
Yeah.
Okay, good. So, eardrops, have you had much success with over the years?
No.
No, okay.
Getting anywhere near his ears
Yeah,
is...
so I think, you know, the swab should just give us the bug and hopefully which antibiotics it might be sensitive to.
You're a good boy,
Mummy.
aren't you?
Mummy.
You let the doctor look, didn't
Mummy.
you? Yes, Matthew.
Down.
Down?
No. Down.
Dance?
Yeah.
Are you a good dancer?
He's
Are you?
addicted to Strictly Come Dancing at the moment.
Oh, I'm addicted to Strictly Come Dancing. Who's your favourite?
Football.
Football?
Football?
Yeah.
So who's your team, Matthew?
Fulham.
Fulham?
Yeah.
Excellent.
Fulham.
Fireworks. Kitty and fireworks.
Yeah.
Your favourites?
Yeah.
Fireworks night's coming up.
Yeah.
We went to see some fireworks last night, didn't we, Matthew?
We're going to watch some fireworks tonight.
No, I'm going to watch the FA Cup.
Oh, sorry. Got the wrong pastime.
Well, yeah, fireworks are for kids, aren't they?
Yeah.
Did you do anything for, like, fireworks last night?
No, I was too tired. And it was too cold.
Yeah, that's true, actually.
I haven't been to a firework display.
You wouldn't believe what my brother's dog did. They were out. This is last year. A hole through the door. I'm not joking. It's terrible.
When did you get her?
She's 3 months now.
Really? And she's a hearing dog, is she? No? No.
She's an everything dog.
An everything dog.
Diabetic dog.
Okay.
So she needs just that.
Really?
To cover.
Yeah.
Very clever.
Brilliant.
Almost as clever as you. Have you got a dog?
No.
I
don't want one. Okay. What pain? Really? Tell me about it.
Because I walk in her all the time. It makes me twat. And the walking with her.
Are you getting it every time you walk her? Yeah. Will you take off your shoes and I'll have a look at your feet and your legs? Okay. Let's have a look. And is there any pain when I'm feeling your legs? Does that hurt?
That.
Yeah. Okay. I can feel some veins there, but what we always wonder about is that we know your diabetes isn't very well controlled.
I'm on the wrong insulin. This is why I'm waiting for the referral to go and see the
And I'll ask about that. That's fine.
I sat in an empty waiting room for over an hour. Right? I couldn't get out of the chair. I can't sit down for very long. Right? I am not a moron, and I don't like being treated like I've got half a brain. I haven't got half a brain, I've got a whole brain, and it functions beautifully. And when I said to him, why am I an hour late? And I did do that. Why am I an hour late? And we take a longer time because we care. I don't give a toss who you care about. Do you know what I mean?
Yeah. It can't be that people are upset by every interaction you have with our surgery. That's not fair.
Could you have a look at a mole I've got that's behaving a bit funny?
I've got burns.
Okay.
And then I have a mole here. It's just a bit scary.
Right, how long's that been there?
Over a year.
You can just feel it, can't you?
Yeah.
So it's quite rough in texture, isn't it?
But anyway, you might be able to see it. Oh, this.
Just looking at it, it doesn't look like anything sort of overly sinister.
I can reassure you that this is not a sinister type of mole.
This is a freckle. Very unlikely ever to cause you a problem.
The things that we do look for in moles, we have an ABCD rule. We look for any asymmetry of the mole, so anything that looks a little bit irregular, any change in the border of the mole. C would be for colour change, so if you're getting darker patches within the mole, then that's something to worry about. D is for diameter, anything that's more than about 6 millimetres. E for anything that's evolving, so anything that's itching, bleeding, anything that feels like it's changing, always come and get that checked out.
Yeah.
Okay. Have a good rest of the day.
Right, you too.
Take
Right,
care.
thank you.
Bye.
What were you thinking we might do about this pain?
Tramadol, actually.
Really? Just painkillers?
Yeah.
We can certainly go with painkillers, but we need to be cautious with you because you are at risk of getting problems with the blood supply to your legs. If you get any chest pain when you're walking, or if you're noticing that when you walk a certain distance you get pain in your legs that settles down when you're resting and then comes back when you start walking again, it's very important that we do get a vascular surgeon to see you, to check on the blood supply to that area.
Does it look like it's got a reduced blood supply?
No, not significantly, but actually...
Don't tell me significantly. Does it yes or no? If it was your foot, would you take it somewhere?
Part of my job is to manage risks. I know that you're at a high risk of having problems with your blood supply because of your diabetes, okay? So it's nice to want definite answers from doctors sometimes, but we can't always get them. It's not, is it?
No,
exactly.
just based on opinion of the individual.
When you came last time...
Oh God,
Why do you say that?
I'm very flexible. I come here.
You
All I
are.
come here
You
for
are.
is to get my
You are.
medicine.
Yeah.
I
There's
don't wanna
flexibility on
ruffle.
both sides.
Exactly.
All right. I'm very flexible with you.
Yeah,
Okay.
you are.
What I would say is, doesn't matter what profession you work in, if someone shouts at you when you're trying to do a good job,
No,
it's
she was
terribly
talking-
upsetting.
Right. The reason why I knew that she was talking is that all your muscles here move when you speak, even if you don't move your lips.
I'm
I am
sorry,
deaf.
you've obviously had
I
it.
am not stupid. I have an IQ of 156. You know, I don't want to be, and how are you today? I could just feel the hand patting my head. No, you don't talk to people.
All right, I will leave
And
that.
this, you know what I feel about that.
Yeah. Do you know, when I see you, do you know probably on average how much time I spend with you?
I know. I know.
Yeah.
I don't understand unless I'm grateful for it.
These are just normal people. We're all normal people, but it just worries me the regularity of it. Abuse within the NHS is taken very seriously in every practice, but the aim isn't just to tell people off, it's to try and work out why they felt the need to react in that way. And usually you can work with people and find a way forward with them.
It was because I was so stressed. I will apologise to him.
Did you?
No, I will.
Okay.
But I will apologise. And
Let's,
as I
we'll
say,
finish now, all right. I'll get that fine. I'll find out what's happening about that diabetes appointment. Come back and see me in a month.
Mum,
Yeah. And we'll see how your legs are doing. Right.
I am sorry.
Do doctors get ill? Like,
Yeah.
like how? They're doctors. Can they just? It must be so weird being a doctor going to the doctor. I think I've had this conversation with you before.
How was your holiday?
Oh, it was lovely, thank you. Very nice. We went to Snowdonia and did some walking. Came back and got a bit ill again, unfortunately.
A doctor got ill?
Oh, yes, quite a bit.
Oh, that's no good. Are you better now?
A little bit, a little bit. I'm usually very well. Last time I was ill was the swine flu, so...
Don't go on holidays. It sounds fatal.
Hi, come on in. Right, so you're here for a refit of your implant.
Yeah.
Perfect. So, is this the first one that you've had in? Yeah, and you've been really happy with it as a method?
Perfect. Absolutely amazing. Couldn't ask for better. Yeah,
Brilliant.
really good.
And have you had any side effects from it?
Not at all. Well, the first couple of months, I think I was told it has to regulate out.
And then you've just had no periods
Nothing.
for the last 40
it's been
years.
perfect, and I suffered
Brilliant.
really badly with cramps and everything beforehand, and it's just completely eradicated the whole thing. I haven't had anything, so it's been great.
Fine, so it won't be painful at all. Taking it out can be a little bit fiddly.
Okay.
Because after 3 years, the body can put some fibrous tissue around it as a little sheath.
Yeah.
Are you happy to get on with it?
Absolutely.
Is it left or right arm?
I'm in here.
You've got it in your right arm.
just
Okay.
there.
Hopefully that will be straightforward to get out. So what we need to do, I pop you on here. So I'm just going to get everything ready on the trolley. The first thing I'm going to do is just do the local anaesthetic injection. Well done. And once this starts working, you won't feel anything else, I promise you. You will be able to feel me touching you, but you won't be able to feel pain. Okay. So, can you feel anything? Wow. I'm just releasing the little capsule that I talked about that can form around it. Okay. It's out. That's pretty quick.
Oh my goodness.
And I can put the next one in. Okay. And you will be done. Just put it on a little pathway just along the side of the original one.
Okay.
Done. Wow. Finished. That was really straightforward. You did really well. And this will last you another 3 years until you come and have your next one in.
Come in. Hi there. Mr. Gomez. Hello, sir. Come on in.
You don't know about me, do you?
No, it's the first time we've met, so no, I don't.
I've been a patient here for a long time. And I've discovered that I had cancer, liver cancer, a couple of months ago, but it's very bad. It's beyond surgery, so I'm going in towards, I think, the end of this month for the chemo. It's going to be a chemo Christmas.
Right.
I live alone, and I'm really struggling with the pain of this. It's extremely painful. It's those I'm taking. They're supposed to be every 4 hours, but I can take them every 1 hour, up to 1 hour if I want them. So I'm taking them every 1 to 2 hours.
Okay.
Sometimes I take them 3 and on the trot, 1 hour on the trot. And then something, but I try not to, because I don't want to build up too much tolerance, because when I get to the end of all this, I'm going to, I'm going to end up taking buckets of it, and I don't want to do that. I've been in so much pain for the last couple of months.
And where is your pain at the moment?
Oh, it's all in this region
on the
here.
side of the liver. Okay.
Yeah, it's all in that region just there.
Okay.
I can't do anything like cooking, getting up, and the other thing is, look, my legs. This is all like water. She said it's water.
It does look like watertight, isn't it?
My feet are like loaves of bread. I can barely get my shoes on.
And sometimes when you have problems with your liver, the amount of protein in the blood drops, and then the fluid is just leaking out into the cells, and that's where you get the swelling. So the idea, I think, probably behind the chemotherapy and all of those things is to reverse some of those side effects of the liver problems.
I hope so. It's I don't know. See, I'm on my own. I'm taking care of myself.
Right.
So it's very, very difficult,
Yeah. Have you got any other support around?
At the moment, that kind of support, I don't want that support,
What kind of support?
Like coming around and cooking for me, cleaning for me, doing it. I want to do that myself until I can't do it again. I've got liver cancer, not brain cancer. I can still function, and I want to do that. Every day's precious. I don't want to give it up. I don't want to give up responsibility. I want to go down to the shop and get a loaf of bread.
Yeah.
I want to touch it before I buy it. Is it fresh? You know what I mean? And I want to do these things still, and I don't want to take that away from me yet.
No.
That's all I've got really. The little things in life, which are the valuable things in life.
Precious.
Just take the dog for a walk on Wimbledon Common with the boy. There's lovely little precious things. But you can't do it if you're in agony.
How long were you in hospital for?
2 weeks.
2 weeks,
yeah. They took me in. They said, your bowel's ruptured, basically. I've been walking around with a ruptured bowel for God knows how long.
And how are you managing now that you are home?
I'm okay. My belly's a bit of a mess.
Okay.
And I've got a bit of a hole here.
Okay.
I'm just worried about, because I wasn't told anything about Crohn's disease. I don't know what to eat, what not to eat.
When you've had part of your bowel removed, your bowel absorbs nutrients, and so depending on what part of your bowel has gone, you need to make sure that you're getting all the nutrition.
Hungry all the time. Is that normal?
It can be. It's a big thing for your body to go through, and your body will be working harder, helping to heal everything up, and your calorie demands will be higher. And how are you doing? A lot of people struggle at the beginning with just how it all feels and looks like. How are you?
I haven't got a colostomy.
Have you not?
No.
Oh, I thought you had a colostomy.
No, I just missed it.
Oh, I didn't know that.
Just missed it.
Wow, so they resected your bowel and then...
I'm really lucky, because I think I'd just die if I had to have one.
I thought you had a colostomy.
No,
okay.
That's why I'm worried about what I eat, because that surgery could happen again, and I don't want one.
No. You're doing an amazing job.
Thank you.
So far.
I don't have very long, and I don't know. I'm going through all kinds of negativities,
About the chemotherapy?
Yeah. Once I'm in there, I'm wired up. That's it. They got me.
Part of my job as a GP, we deal with people who have terminal diagnoses, and it's always upsetting to be with someone who is going through those stages of life. You have to try and keep that emotion to yourself, and make this the interaction about them.
What are you worried about? What worries you? The agony of
it. I know
the pain there.
I know what's coming. Yeah, I already know what's coming. I can feel it. but with the chemo, I can possibly push me up to a year, maybe beyond.
I'm always impressed by how people find resources within them to face the final days or weeks bravely.
I've got a severely disabled lad. He's blind. You know, I've been his sole carer for the last 16 years.
Right.
It's my son, yeah.
Yeah.
And I need to prepare him because he's acquired brain damage. You know, he needs to be prepared for this one. You know, we protected him when his mum had cancer, and she died, and he was in a mess. You know, so now he's going to have no one there.
Does he have any carers or any?
Oh yeah.
He's got people around him.
Yeah,
Okay.
he's with guide dogs. You know, he's got a guide. So but
So there's all that worrying you.
Yeah.
As well about him.
His welfare. Yeah, his mental state. That's what worries me. Yeah.
And what kind of support, ideally, do you think he would benefit from?
Well, that's what I mean. I want about a year to sort of watch it. You know, I need a year to get him prepared and to be prepared to be on his own now.
Yeah.
You know, there's things I need to settle and take care of. Yeah.
If you have a think, and if there's anything else you think you need help with, or we might be able to help with, will you just give us a shout, and we can work it out?
Yeah.
I'll give you the amounts, more of these both.
Oh, the same again. Yeah.
Yeah. I'll give you a bigger volume.
Yeah.
So that he doesn't run out.
Because I need to get this under control.
Yeah.
The management, the pain management. Yeah.
The pain we will get under control. The pain will get sorted. All right.
Very much.
Nice to see you.
Very much, Doctor.
Give me a shout if there's anything else.
Thank you very
All right.
much. Thank you.
Take care now. Cheers. Bye bye.
Come in. Hello. How are you?
Okay.
You're wearing glasses. Oh dear.
This is just this morning. Sunday was kind of okay. It was a bit swelling underneath, and then this morning, swelling even more than this.
So it's got better throughout the day?
Yeah, a little bit. I did take an antihistamine in the morning.
And do you think the antihistamine's made much of a difference?
Not really.
And then, is it very itchy?
It's not at the moment.
It's just very puffy and swollen, isn't it?
Yeah.
And you're not wearing any eye makeup or anything like that?
No.
Poor you.
I'm also concerned that, the flaky skin bit kind of seems a bit yellowy.
One of our doctors does have a special interest in skin. Let me see if my colleague's available, just to get a second opinion.
Is it just on your face?
The swelling is, yeah.
If we give you 2, so we give you the 1% hydrocortisone.
Yeah.
Use the stronger one for a couple of days.
Okay.
Just to get it down, get some of the swelling down.
Yeah.
You're going to have to moisturise well, because as soon as that swelling has gone down, you're going to go wrinkly.
Yeah, yeah.
Which is horrid. What job do you do?
I'm a teacher. I've got parents' evening tomorrow.
Oh dear.
Do you feel sort of anxious or worried?
I'm not sleeping very well at the moment. Which is very unusual for me. I wake up all the time.
I'm still not sleeping properly. I haven't gone back to work yet because I've got another situation with another doctor.
Okay.
And I prefer to have another couple of weeks off so I can get my head together and think what I've got to do.
And the problem with sleeping, I don't get sleep at all. Because of the stress, the workload, what I do could be the reason. And tiredness is for the last 2-3 months. I'm really, really tired.
I mean, this kind of gives a good description in some ways of what you've been experiencing. You're finding it hard to kind of see the light side of life and not enjoying things as much as you used to.
That's been quite a stressful few months.
It has been a stressful few months. I can't get through the day. I'm kind of worried.
But small steps, because you've come a long way.
Hiya. Come through, Tony. How are you?
Well, thank you.
You look great. Like trousers.
Thank you.
They're fab.
Back
at uni, so...
Oh, right, OK. What course are you doing again?
English literature.
Right, yeah. I got a letter from Dr.
Ducci, yeah.
Yes. And you're on a waiting list for psychotherapy?
Yes, I'm currently seeing Dr. Healy at the Wandsworth Complex Needs every 3 or 4 weeks.
Right.
When I first found out I was diabetic, it definitely really threw my mental health, and I think I definitely wasn't coping for a period of 6 months, and I think I've got over that phase of, I think it's called burnout, when you stop testing and you stop really trying to look after it, and I think I'm testing 3-4 times a day now. I'm really trying to get a control of my blood sugar.
Yeah. Whenever a young person, particularly that has had a mental health problem, gets a diagnosis of type 1 diabetes, it's a very difficult combination. I haven't seen you when you're unwell with your mental health. And Dr. Ducci's indicated that you've had some really difficult times in the past.
I lost my mum when I was young, and I was initially born in South Africa, and now I'm at 15 social services intervened, so I've pretty much looked after myself since I was 15. So that's probably a lot of the issues. It was very early independence.
And were you very vulnerable at that time?
I think so. I think asking any 15, 16-year-old to look after themselves is a big thing, but I wouldn't have changed it because I'm here where I am now. And
brilliant.
Yeah.
I know from my experience of being a patient how much courage it takes to come and sit in the chair of a patient. It would have been about 15 years ago. I had an eating disorder throughout medical school, and it happened at a time when I was a single-handed GP running a practice on my own. I had 3 children under 5, and I was working very long hours with very little sleep. It was very difficult to sit in that doctor's chair day after day, year after year, telling people to look after themselves when I was crying out to be looked after myself.
I think you're very self-aware, and you're obviously resourceful, built self-reliance, but just let people in as well.
I went downhill pretty quickly until one day I could only get halfway to work and decided I couldn't do it anymore. And that's when we called our own GP and asked for help.
Is that everything?
Yeah, I think it is with me.
Yeah. Have a good day.
Thank you very much.
Thank you.
Bye, Tony.
I've come through. I'm able to truly accept that illness is not your fault. And doctors are patients too sometimes.
Good morning, Holford Health Centre. Sally speaking.
What would happen if those feelings got worse? What would you do?
Before, especially first year of uni, I drank a lot. For like 3 bottles of wine within the space of 10 minutes.
Have you had sex yet?
Who wants to have sex 6
No.
weeks after giving birth?
Now, I'm going to need you to lie on your side. So next thing you feel will be a slight prick as we put the needle in, OK?
Have you got any illnesses that we should know about that you've had before? Are you on any medication?
I was shot a lot of times.
I'm unhappy to mention it is affecting my sex life.
So what the bruising is?
Yeah, it's actually spread across into my genitals, basically.
Oh, goodness me.
centre. Help me, sir. At the moment, we're working on a morning surgery, so if it's urgent for today, it is going to be end of surgery at 11:30.
Sarah, Jean's please.
I've got this
All right.
on my leg.
Yeah.
Now, this is the 3rd or 4th time it's come up. I've had steroid cream.
Uh-huh.
I've had penicillin antibiotics.
Yeah.
It started off as a bite or a sting on that spot there.
Right. When was that?
8 weeks ago.
Was it?
And it's coming up again. I finished the antibiotics last Thursday.
Yeah.
So it's a week, and it was fine, and now it's starting to flare again.
Just have a seat. I'm going to come and have a closer peer. So when you use the antibiotics, what happened?
It seemed to get better.
Right.
And then but like I say, it's flaring up again.
So when you use the antibiotics, it makes everything better?
Well, it
Or
did
does
do.
it not?
Yeah, no, it did, yeah.
Yeah. How many courses of antibiotics?
First of all, I put bite and sting cream on
Yeah.
it. Then I had steroid cream from the doctors, and then a course of antibiotics.
OK. Do you get psoriasis at all?
No. I've never had psoriasis, although my mother is riddled with it.
Right, OK.
Hello. Just returning our key.
Wonderful. If I could ask you to put that straight on one of the top first 4 hooks, that would be very gratefully received. Thank you very much indeed. Pleasure doing business with you.
Come on in, have a seat.
All right, thank you.
I'm Dr. Graham.
Hi.
We haven't met before.
No.
You're a new patient here?
Yes.
Yes, you've moved from a local practice?
Northville.
Yeah. So what do you think are your main medical issues at the moment?
My breathing.
Yeah, sounds like it, doesn't it?
Struggling the last few days.
Right, so you've got COPD.
Yeah.
Yeah. And any other, you've got diabetes.
Well, they think I have, but they think it might be to do with, because I'm on so many steroids.
Right, OK, well, we'll talk about that in a minute. And then, so you have, obviously, home oxygen.
Yeah.
You've got a high cholesterol, high blood pressure. You've had heart disease.
Yeah.
The steroids, what do you think you're on the steroids for?
That is for...
polymyalgia rheumatica.
I can't never say it.
You've got your cholesterol tablets, atorvastatin, yeah?
Yeah.
Candesartan for blood pressure. Then you've got the bone-protecting calcium vitamin D tablet. Lansoprazole for your stomach. Nebivolol, which is for your heart.
Yeah.
Sertraline, antidepressant, and spironolactone, which is sort of a water tablet. In your last practice, they decided that you do have diabetes.
Right, OK.
OK? Have you seen a practice nurse ever for a diabetes check?
I think I've got an appointment with one to see about it.
OK.
On the 8th.
Brilliant, yeah, you're seeing Mike.
Right,
and he's actually going to do a check of your heart disease, your diabetes and your COPD.
Shall I bring packed lunch? OK.
Bring a packed lunch, yeah, not a bad idea. So the bottom line is you've got a lot going on, haven't you? But it sounds like, to be honest, you're fairly on top of it. You kind of have quite a good understanding, I think, of what's going on.
Yes, I do understand.
Really, your heart scan suggests that you've got a little bit of heart failure, that your heart, normally it pumps like this, but it's sort of pumping like that. And that's why you need a bit of help with your fluid, OK? So I'm your doctor.
Yeah.
And we have a system here where we try and get you to see your own doctor as much as possible. If it's a query, then you can book a telephone appointment and I'll call you back. I think we just need to get you to know you a bit.
OK, then, thank you.
Good.
Right.
Great. Nice to meet you.
Yes. Probably see you again.
Yes, I'm sure. OK,
All
bye
right,
now.
Thank you.
Sometimes with psoriasis, if you are prone to it, and sometimes it occurs in a place where you've got an injury, a trauma.
OK.
And of course, the bite and the infection may be enough to cause a patch of psoriasis. Sometimes bacterial infections with the commonest thing that causes skin infections called Staphylococcus. So have you heard of those bugs? Well, they cause skin infections really commonly.
Okay.
They can sometimes cause blistering. So it's a little bit of a mystery. I think what I'm going to suggest that we do is the antibiotics seem to work. I'm going to give you a higher dose and a longer course for 2 weeks and then see what happens. But if it's not settling down, we'll see you again. And if it all goes away, then job's done. All right, nice to see you. Yeah, no problem. Nice to see you. Bye.
Bye.
OK, that's fine. If would like to go to the upstairs waiting room?
OK, no problem.
Thank you. Hello, can I help?
Mr. Apatrasoe.
Yep.
I'm Dr. Lee. Come on down.
Expect to be from China.
Yes.
Or Jet Li or Bruce Lee.
Yes, come and have a seat. People often expect a Chinese doctor with me.
Doesn't matter.
No, have a seat here anyway. I think you're a visitor. Are you visiting us? Or are you a patient here?
For the moment, I need to subscribe, you know, because I need the doctor.
You're up in Brown, and that means you're what we call a temporary resident, I think. But you're living here, are you? Are you going to register permanently here?
I have, yeah.
Where have you come from?
My father from Belarus, yeah. My mother from Greece.
Okay.
From Athena.
Yeah.
And I'm Danish resident. After the high school, I was a security officer from army. SWAT, you know, the special squad.
Yes.
You know, paratroops and other things.
Have you got any illnesses that we should know about that you've had before? Are you on any medication?
I was shot a lot of times.
What's brought you here today?
Throat, headache. That's the only reason why I called up, is because I had this sort of quite bad headache this morning.
And how long has he been complaining of headaches for?
Since he started a nasal spray.
And it's all the way from here?
From here.
Down to...
Here.
Down to the back there?
Yeah.
Sometimes it's right on the center.
Oh, it's in the middle, yeah.
Inside, really, you feel sort of heat.
I was shot a lot of times.
Do you want to tell me a bit about it?
I was cut here. This is from 1986. This is from 92. I have another one here. I was shot here. And 48 part of metal was here.
Oh, yeah.
And take it out. But I'm perfect, no problem with this.
Okay.
The only thing what put me down, it's sinus. I have pain. Sinus, yeah. No. I don't feel good.
No. And you're not taking any tablets or medicine?
Today I don't take it nothing.
No, right. So is it here? Just right there.
Yep.
And then if I just take those off. So here's your other sinus. That's your frontal sinus there.
I know it's facial sinus.
Yeah.
I know about this. This you have a lot of sinus.
Yeah, and
but
these
here it's about this one.
And these ones
not
are all
this.
right, are they?
Yeah. Malar sinus, it's okay.
Okay. Is there anything coming down your nose from up here?
Yeah, was yesterday some like yellow things, and in the morning blood.
Okay. A bloody discharge is very characteristic.
It's good if you
I'm just going to do your blood.
Go out.
Yeah, but it does make it very likely that your sinus is infected, so you have diagnosed yourself correctly, I'm sure. Okay. Relax a little and I'll just see what this is going to be up to. It's 184 over 104.
Because of pain.
Do you think? Okay.
I'm pretty sure about this. Okay. Because normally I have 137.
But I'll print you out an antibiotic to take for this. Are you allergic to any antibiotics?
No. I'm allergic for the stupidity. The only thing.
Take this, 2 today,
yeah,
and then 1 every day till you've used them up for a week. And that should settle it down. You must now book an appointment
yeah,
for maybe 2 or 3 weeks' time to come and have your blood pressure checked again.
Okay.
And I hope you're better soon. Yeah.
Thank you very much.
Thank you. I hope
welcome
to see you in 3 weeks.
Come on in. Have a seat.
Thank you. Yeah, I was in hospital all of last week.
Oh dear.
Because of the DVT thing. It bled everywhere.
Bled?
It was. I think it was a varicose vein on the surface of that.
Yeah.
I was washing up and it just bled everywhere.
So it was the bleeding that kept you in hospital?
It was the bleeding that kept me in hospital and the swelling of my leg, and they said that the DVTs got bigger.
Have you got an appointment with the haematology doctors, the blood doctors?
Yeah, I'm getting one. Okay. I'm literally waiting to hear.
Is there anything to see, or is it all covered up with
all
big
covered
dressing?
up.
Let me not look now, because actually, as long as it's OK from your point
Yeah,
of view?
it's
The
all
nurses
right.
are going to look this afternoon, so if there's anything if I take the dressing down and it causes loads of bleeding, then we'll have to get the nurses involved.
Also, as well, I haven't been on them for a while, but I was on citalopram. I feel kind of OK, but I'm kind of waiting to go down.
And was it depression that you suffered with before, or did you get much anxiety with it as well?
Yeah, the anxiety's kind of gone.
And when people get depressed sometimes, they get, other thoughts or other...
Yeah, I have been there.
More serious kinds of thoughts.
Yeah.
Has that drifted in, do you think?
Yeah, a little bit.
Hello, can I help, sir? All right, can I help?
That's exactly why I'm here, hearing problem. You going on?
I know, absolutely.
Catherine Amesbury, please.
Oh, that's me. OK.
Hi, come have a seat.
Nice to meet you.
Right, OK, so we spoke on the phone beginning of June, didn't we, about your X-ray? Yes, OK. And how is your back?
Bad.
Right.
I've got a trapped nerve now. It's just constant pain. So
OK.
I don't know. What did the X-ray show?
Well, it shows some wear and tear, but it also shows reduction of the disc height on a couple of levels, so it makes me a little concerned. Is there any thinning of the bones?
Well, I've got sciatica at the moment all the way down this leg, and my leg's actually not working properly.
Right, OK.
It's really strange. It's like it doesn't belong to me.
OK, can we have a little look?
Yeah.
Pop yourself up on the bed. OK. And if you bend this, so try and pull your heel into your bottom. OK, and push it up to the ceiling. Good, OK. Against again. That's it, right?
That's the weak one. Can you see where it's wobbling?
I'll just check your reflexes. Yep. Good. Fantastic. OK, you can jump up for me. OK.
I had a riding injury.
Right.
In my very early 20s, and I displaced 2 vertebrae. And it never was quite the same after that.
Sure.
But regular osteopathy. I mean, I can go for 2 or 3 years without seeing her, and then I'll tweak it, and she'll get it right. But this time, I just haven't known how to get it right. So, yeah, I'm just frustrated because I can't live my life the way I normally live it.
Yeah.
My maternal grandmother had osteoporosis. She was bent double in her 70s.
Right.
But I have been on prescriptive calcium, vitamin D since my 40s because there was a risk.
So this graph shows us the green is essentially you don't need to do anything, OK? The yellow is we need to measure your bone density via a DEXA scan, and red, we need to just treat. Now, you are very much on the border.
I'd like to know then if I can.
I agree. In terms of your pain and management at the moment, are you happy with what you're doing?
Yeah, I don't want any.
No. So we'll wait and see what DEXA shows. If you want some physio, just let me know.
Thank
All
you.
right, no problem.
Lovely
Nice to meet you. Yeah, you
Thank
too.
you ever so much.
OK.
Let me just check. You haven't had any more suicidal...
Not since being at home.
...plans or hopes to die or anything getting so serious that it's got that bad? No.
Not since coming out of hospital.
What would happen if those feelings got worse? What would you do?
Normally, I lock myself away for 24 hours. In the past, what I've done, completely just lock myself away, don't do anything, don't allow myself to eat, don't allow myself to go to the toilet, nothing. And then I normally come out of it. Before, especially first year of uni, I drank a lot.
That's a common reaction or way of dealing with it.
And a lot quickly. So like 3 bottles of wine within the space of 10 minutes, like a lot.
Gosh, that is a lot. Mental health problems are really common, and young men suffering with depression is one of the things that we see very commonly in the surgery. William has suffered with on-off recurrent depression over the years, for which we've been supporting him. The natural feelings that you have when people first tell you about something really deep and personal is to empathise and do your best to be compassionate with them. And then the next stage is to try and move on and come up with some solutions to help them move forward with that problem. So it sounds... I mean, this is obviously complicated, isn't it? What about any counselling? Are you having anything at the moment? I'm just going to look at see if I've got any past history here.
Because I know I was on 10 milligrams and they increased it to 20.
How long have you been on it for?
Oh, God. It was when I was in sixth form, so when I was 17.
Yeah. So you've been on and off it for your mood for 6, 8 years?
Yeah.
It does take between 2 and 6 weeks to have its full effect. And starting off slow and building up is a sensible thing, because then there's less to come off later. Do you want me to organise some counselling for you or give you the details about that? Because that's one of the other mainstays of treatment.
Yeah, that'd be cool.
And as I say, if anything changes or gets worse in the meantime, just let us know more urgently, obviously.
Oh, I do. Awesome. Thank
All
you
right,
very
nice to
much.
see you. Bye, then.
Bye-bye.
Hello, reception.
Hello, I need to make 3 appointments.
Hello, come on in.
Suffering terrible with migraines. Been suffering for about 6 years. I did get a preventative topiramate.
Okay.
It worked, but it stopped working now, so I've just given up taking it. I just thought it's best to come in and see you.
Yeah, have a chat about it. How often are you getting them at the moment?
I can get 5 a week sometimes.
Describe them for me, just
So I go funny in the eyes, and the head feels like it's being, and it's all pain in the neck as well. Just like a pressure building up, and then you feel like you're sort of slurry talking and things. So it's just strange how they just come on all of a sudden. The Immogram tablets are really great when you get an attack, but they do make you feel a bit... But they're brilliant for when they are needed.
So they're quite effective.
Yeah, amazing.
Yeah.
I just wondered if there was any other type.
Preventative, yeah. The answer to your question is yes, there are other things we can try. There are actually quite a few different preventative treatments for migraines.
Okay.
So we often try beta blockers, which were originally designed as blood pressure medication.
Okay.
But we use them for migraine treatment. They very occasionally drop people's blood pressure a little bit, and that can make you feel a little bit dizzy the first time you take it, while your body's adjusting to it. So we'd often try one that's twice a day.
Oh, twice a day.
Initially, I'll give you a month's worth as a kind of trial.
Okay.
If you find that it's not really the answer, give me a ring or come and see me again.
Yeah, it's easier to find sometimes, isn't it? Thank you very much for your help.
Great to meet you.
Nice to meet you as well.
Hello, can I help?
Hi there, it's Dan from Speechwrite. I've got an 11 o'clock with Guy.
With?
Guy. Guy.
Glyn.
Glyn, is it? Oh, they put
Oh.
Guy. Sorry, Glyn.
Leave me. Scarf, though.
Just get a phone and begin.
I'll probably be still sat here.
Probably.
Okay.
If you're not, I'll be lovely. Sean Priest, please.
Oh, here we go. That's me. Hey, brilliant. Hey, can you guess what it is yet?
Oh, mate.
Oh, yeah, definitely, yeah.
Right, I'm Lizzie.
Hi.
What's been happening?
So, Tuesday of last week, I had a motorbike accident, collision with another vehicle. Fortunately,
Car?
yeah, well, Volvo, so, you know, might as well have been a tank. Yeah. So I was thrown clear of it, landed on the verge, but I took all the impact on my hip. I managed to sort of bounce off the side of it and do a bit of a Superman impression.
Through the air.
Into the verge on the other side of the road. Basically, I can't sleep. That's one of the main issues because of the pain. Also, I've got some concerns. The blood from the bruise is beginning to spread. It spread around my sort of lower back, down my leg. It spread across my groin and into other areas.
Right.
Yeah.
Okay.
Yeah. So that's kind of a bit interesting there. So.
Okay, can we have a look?
Yeah.
All right.
Sure.
See how bad it is.
Yeah. No problems. I'm unhappy to mention it is affecting my sex life, as if having a smashed up hip alone wouldn't.
So what the bruising is?
Yeah, it's actually spread across into my genitals, basically.
So, oh goodness me.
How are you, Michael?
Struggling, very difficult.
I understand you had a fall a few weeks back, was it?
Tuesday. I'm always falling over my hips.
I don't remember bumping it. And I span, and I fell on my right side.
As I've jumped and sort of came down and landed on my leg, it's gone backwards quite a lot.
I tripped and then I landed sideways on.
Sleeping is just, forget about it.
When you say it's affecting your sex life...
It's spread into my testicles and pretty much halfway up.
Meaning that it's painful, or you can't get an erection? Or...
No, I'm functional, but it's tender, really very tender, yeah. So, yeah, if I could figure out how to manage that, that would be nice. Or just an idea of how long this is going to go on for.
Right, so, OK, pull your pants up.
Yep.
Come on, have a seat again. So, the amount of bruising that you've got,
yeah.
I'm not surprised at. I wouldn't be overly concerned about it. Given the mechanism of injury, if we've come away that lightly, it's probably only down to the fact that you're quite muscly and you've got muscle to protect all of your bones and everything.
And muscle that bruises easily.
Yeah. You've obviously caused so much damage underneath your skin on the hip here.
Yeah.
It's filled to a capacity and then it's not really had anywhere else to go, so it has spread round the other sides a little bit.
Yeah.
Have you noticed it carrying on, spreading further? Or
Yeah. It's reached the back of my leg just today. It was about here before, but this morning it's sort of down there. It seems every time I wake up, you know, it's in new and exciting areas.
If at any point it looks like your circulation is changing at all, you know, if this lower leg starts going a bit of a funny colour, if you start to lose some of the sensation or anything like that, need to see you straight away and probably send you up to the hospital. In terms of what you can do to try and reduce it, the only thing that you can really try is just to ice it.
Is there anything I can do for the sort of pain management side of it and sleep?
Paracetamol, 2 tablets, 3 times a day during the day, and then your 2 cocodamol at night.
Okay. Are there any kind of like maybe almost like home remedies I can use to sort of try and disperse some of this blood, or?
Just gentle. You could try a gentle massage.
I'm talking about one specific area.
Not like deep tissue. Oh right, okay.
Yeah. It's not pleasant, and it's
There really isn't very much that you can do.
Okay, I'm happy to try deep tissue massage on the area. But,
I was thinking of your leg.
Brilliant.
I would just give it a rest if I was you. Yeah. Just give the whole area, just give it a rest.
Right, okay.
If it's hurting, it's trying to tell you, you know, give it up. Just stop for a bit.
Okay. Put it on the back burner.
Yeah.
Brilliant.
Abigail Lee. You can walk like that.
I can walk and feed.
Well, I'm Dr. Lee, so that's very good.
Yeah.
We share a name.
Appropriate, isn't it?
Hooray. So, is this a girl or a boy?
A boy.
Oh, very nice. And is it your first or not? Oh. So today, starting with you, how was it?
What, the birth?
Yes.
It went as well as such a thing does.
Yes.
Basically.
It's quite an experience, isn't it?
Yeah, and we had a home water birth. And that went really, really well.
Ooh,
I mean,
did you?
Yeah.
For a first baby, that's very good.
Yeah, it went. Yeah, it was. Well, you know, I won't say it was good exactly, but it went well. I didn't use anything, and yeah.
Well, it's very unusual to actually manage your first at home.
Yeah.
Did you tear or have stitches?
I did tear and I did have stitches. Yeah, I had a 2nd-degree tear.
How is it? Has that healed up quite well or not?
Yeah, I think so. I mean, I don't feel anything anymore, I guess. I'm not sure when it sort of... Oh, thanks for that. I'm not sure when it stopped hurting, really. It did hurt for a lot longer than I expected it to, I have to say.
So would you like me to have a look? Or
I think
if
I'm
it
all right,
feels
to be
fine
honest.
to you, it's never quite the same as
Yeah.
it used to be. But as long as it's not too tight, really, that's the thing. Occasionally people get sewn up and they're just a bit wonky or tight. And that often settles down. And
That's all right.
sex, have you had sex yet?
Who wants to have sex 6 weeks after giving birth?
Hello, morning. Come on through.
Hand over your mouth when you're coughing.
Come on in.
Hello.
Take a seat. Hello.
You all right?
Yes, not too bad, thank you. So, Riley, you're nearly 11.
Yeah.
You've got this terrible cough.
Yeah, it's been about 3 weeks. Basically said it's starting to hurt his chest a lot, but I don't know whether it's just because he's coughing so much, but it's getting deeper and deeper, so...
So it's been there for 3 weeks already, and it sounds like this day and night?
Yeah, it gets worse at night, definitely. It's constant.
OK. Any temperatures or anything like that?
A bit hot now and again, but nothing major. It's just...
And are you bringing up some rubbish when you cough?
Yeah.
Do you want to put your top things off for me? And is Riley up to date with all vaccines for his age? Looks like he is.
Yeah, he doesn't really go to doctors very often, as you can see. He's very limited.
Yeah.
It's probably been about 10 times in his life.
Let's have a look in your throat. Open wide for me.
Turn out. Ooh,
okay,
where are you going, Bert? It's okay. Who's that? Peppa
Let's have a listen to your chest. If you come up here for me. Yes, please. Pop your T-shirt off. Excuse me.
Where's he going?
Come and take a seat there, OK? Yes, that's fine. Deep breaths through the open mouth. OK.
Where are they going?
That's fine. I'm just going to have a feel if there's any glands around, OK? That's fine. You can pop your things on. Come and take a seat.
How are we sounding then, Doc?
Well, I mean, the chest actually doesn't sound too bad.
OK.
So the cough sounds worse than the findings. So there's no temperature, you know, everything else is sounding OK. I'm a little bit suspicious of whooping cough. Pertussis is the other name. You know, it's just tends to go on for a bit, and it's sort of, once you start coughing, you go on and on and on and on, and then stop, and then it keeps going on like this day and night. So I'm wondering whether we should do a swab, actually, for looking for pertussis. Whooping cough is a very severe spasmodic cough, by which I mean you get bouts of severe coughing, and according to the textbooks, a characteristic whoop sound at the end. However, in real life, you don't always get that. It usually goes on for 2-3 weeks, and patients present very tired with their symptoms, often not sleeping due to their symptoms. If you wanted to look it up, you can on patient.co.uk.
No problem.
Website. OK.
Quick nose swab out there, is it?
That's just... If you take a seat in the waiting room, and we'll get that organised straight off. There's a key and a phone.
That would be me, yeah. Thanks. Come on then, Fatty.
Sweetie. Hello.
Come here, please.
Hello. No, they can do with all the help. They need all the help they can get. He's just looking at flowers. It's fine.
Yeah.
And did you have any other problems in the pregnancy that I should know about?
My left outer thigh went numb, went about 20 weeks, and it's still numb now. And I assumed after I gave birth, I thought, oh, it'll just go away, but it hasn't.
Which bit of... It's on the outer border there?
Starts about here, goes down to about here.
Are you all right?
Yeah, of course.
Take him over here. You can just lie him on you.
Do you think you could hold him just for a sec? So I leak really badly, and I've got these breast shells. It's a bit embarrassing, and I frequently do that as well.
Well, I'm having to practice because my first grandchild's coming soon. So
oh wow! Congratulations!
I know. So this is kind of fabulous.
Just up here,
like that, and then if you take him.
Yeah. Hello, little one.
Ooh. Okay, that's great. So here's a bit of cotton wool, and I'm just touching your other leg with that. Can you feel that?
Yeah. Yeah. Yeah.
And how does it feel? Is it?
It's really hard to describe because it isn't.
It's less.
Yeah, it's just less. That's the only way I can think to describe it.
Now, I'm not going to hurt you with this, but I'm just going to... It's a pinprick.
Yeah. Yeah. It's very, very slight, though.
The good thing is the sensation is actually there.
Yeah.
Get that back up. I'll come and help you in a sec.
Thanks.
So the sensation is there. That nerve has obviously been probably bruised at some stage.
Thanks.
I think it's a matter of waiting. The nerve is working because you can feel pinprick, you can feel different kind of sensations there. And although it's a bit dull, it will slowly come back.
That makes
Sit
sense.
tight, it will almost certainly just slowly recover.
Hi, I've run out of my pills. I don't know if I need to make an appointment with the nurse or can I just get a prescription?
Contraception.
Yeah.
A nurse appointment every time you need a prescription.
Oh, is it now? Oh, I thought it was every, 6 months or something.
Hello there.
All right.
Come along. So I think Dr. Pitt arranged for you to come and see me, is that right?
Yeah.
Yeah, and prior to that, you'd seen a physiotherapist who thought that it might be useful for you to have an injection. Yes. And they've written in the note that they think you've got something called trochanteric bursitis, which is a inflammation in the layers over the hip joint. Yeah. On which side is that? Is
on the left.
Left side. Yeah. Can you show me where the pain is?
I'll stand up and show you.
Yeah.
There.
Yeah, let me just have a feel down here. If I hit a sore spot,
yes,
that's it there, is it?
Yes.
Oh, sorry. Okay. Well, that is over what we call the greater trochanter, so that would fit with this. So what Dr. Pitt suggested was that maybe we put a steroid injection into that spot. So you're happy to go ahead with that on that proviso? Okay.
Give me back my legs.
Sorry?
Give me back my legs.
Well, don't have too high a hope, really. My hope with this is that we will relieve the tenderness at that sore spot.
It's worth a try.
It's worth a try. So I'll need you to get up on the couch. What we've got here is some steroid with local anaesthetic in with it. Any problems after this injection, particularly if you feel that it's inflamed or you've got a fever, do get back in touch with us. Okay. Now, I'm going to need you to lie on your side. I'm just going to mark the point. So next thing you feel will be a slight prick as we put the needle in, OK? I'll need to put it... Is that OK? Not too sore? OK, that's done. All right?
Is it? Is it done?
Yeah, it's done.
That's incredible.
OK, stick that on there. Good, we're done. All right? Do you want a hand down? Are you OK? Sorted?
Thank you very much.
All right. But we might do it again if it does work and it wears off.
It doesn't feel like anything's different.
No, but it won't work immediately.
Oh,
Give it a bit
OK,
of time.
thank you.
Give it a bit of time. OK, then.
Chris Collins, please. Morning.
Morning, Doctor. Thank you.
Hi, have a seat.
Well, basically, the big reason I came in is for the results. Are they, for the scans? And they took me into the ring thing, that you go in.
OK.
Yeah.
Let me just have a little look. I'll just get up those results. Well, the good news is that the scan is normal, and if you get more blood in the pee in the future, then we should send you back there. But at the moment, that's all that we need to do.
Right.
So that sounds like all pretty good, doesn't it?
Yeah.
And how's your mental health at the moment? How's that all going?
Oh, not too bad. Having moments when I sort of talk to myself a bit. Not answering myself, but...
Has that been stable in the background, or is that...
Yeah.
Yeah.
There is some times when, and I got... he comes from the Greenway Centre, and I talked to him about it, that sometimes I'll look at someone driving past when I'm on the bus and think there's someone I know, and it's just trick of the mind,
Sure.
But I think I have, at the station, actually seen a poltergeist,
Great, well, how are you?
What I've got is face ache and constant gunk at the back of my throat.
So the face ache, sinus there, sinus here.
Yeah.
You're talking about her mouth breathing.
Mouth breathing?
Yes,
Okay.
she continuously breathes from her mouth and not her nose.
I'm sick from the infection because I end up swallowing it, and the pressure behind my eyes and in my face is horrendous.
So can I feel on your face?
Yeah.
And is the stuff coming out of your nose?
A little bit, and when it is, it's like thick and yellow.
Come on in, have a seat.
Right, Maddie, do you want to sit over there? Rio, you can come over here.
OK. How can I help?
So Rio suffers nosebleeds.
Yes.
Quite severely.
Yeah.
Through the weekend, he had 4. 2 were very, very bad. Really struggled to stop them. I pinch it up here. It then goes down his throat.
Yeah.
And he spits it out. So I literally have to just wait for it to start congealing in his nostril. Yeah. He cries with them as well. I don't know whether or not they're hurting him.
Yeah.
Since then, he's been very lethargic, very pale. I don't know whether or not he could get anemic from it. I have no idea.
How long did they last for?
So the first one he had, that lasted maybe 2 or 3 minutes. And then a couple of hours later, about 7 or 8 minutes. That was quite a heavy one. But then the last one, the third one, which was sort of in the middle of the night, that was quite severe. It was about 10 minutes. Okay. And we're going through like
show me, Rio, show me what Mum does. Show me where Mum puts the pinching. Up the top there. Okay. So you need to pinch much lower down. Okay? So that bit there is a bit solid. You can feel it's a bit solid, yeah? Whereas where it's actually bleeding from, almost certainly, is just inside. So what you need to do... Is it always that side? Yeah. That side, so if you had a cut on your knee, what would you do?
Why?
What would you do if you had a cut on his knee? Yes, so you go like that. So to put pressure on the nose, in that bit of the nose, you have to pinch the lowest bit, OK? But mainly it'll just make a scab, and that's what you need, is you want a scab, OK? So can I have a quick look up your nose? So if you just look up at the ceiling, very gently. And he's definitely got quite a good scab there now, OK? So the important thing is not to touch it at all, OK? It's quite common nosebleeds in the summer. Because the blood vessels get bigger anyway. Okay. What I would recommend is actually pinching for 10 minutes. Okay. So the bleeding time should be 10 minutes or less. So by the end of 10 minutes, it should have formed a really nice scab. Yeah. And then it just needs to be left alone. Are you happy with that? And, you know, you're nearly at the age where you might be able to do this pinching stuff yourself, to be honest. Yeah? Rather than Mum doing it. Yeah? Nah. Is that all right?
That's great. Thank you so much.
You look very well.
Thank you very much. Getting there.
All right.
Come on then, kids.
All right, kids.
Thank you.
That's okay.
Bye.
Bye now. Bye, Rio.
Well, I know that in the past you've had problems with, you know, ideas that have been difficult to explain, haven't you? And delusions that are linked to your mental health problem.
Yeah. One stage, a car went, this is a long time ago now, car went past, and do you know Data out of the Star Trek The Next Generation, the robot? I swore I saw him in the car, which was quite funny.
The mind does play tricks on people, doesn't it?
Yeah, and I actually, I do actually see them. You know, I do actually see, it's not as though I sort of, there's a blank space and I imagine something. I actually see something through my eyes, which is...
And that's what, you know, when people talk about hallucinations, that's what people, they're like, you know, they're really there for people.
Yeah.
And that's a really good description. So it's certainly not, nobody's saying that it's, you're not seeing it. It's just that that's part of the mental health issue, we think. Hallucinations are part of a group of disorders called psychotic illnesses, schizophrenia being probably the most common of these. For some patients with chronic psychosis, they don't have the insight that means that they can see the hallucinations and delusions that they're suffering are not real. And this adds huge challenge, as you can appreciate, to how we can support them and treat them. Fortunately, Chris is in a good place at the moment, and his medication is controlling those symptoms, and his hallucinations are something that he recognises, and so currently he has good insight into his mental health problems and how they're affecting him. We'll carry on with you being supported by the mental health team at the Greenway Centre.
OK.
And then I'll see you probably in 2 or 3 months if everything's going well. Super job. Well, nice to see you.
OK, Doctor.
Till next time.
All right.
Bye.
Bye.
Good morning.
Have you date of birth?
23rd August.
It's next week, my lovely. What date? You did it online. 12th, next Wednesday. Exactly the right time, but a week early.
Kirsty Winskill, please.
I like your top.
Oh, thank you. Right, I'm Lizzie. I'm one of the urgent care clinicians. How can I help you?
We'll get with a throat infection. This morning my throat is bright red. My voice is gone. It's very painful.
Yeah.
I've got a friend's wedding to go to tomorrow.
Oh, no. No singing for you. Is it a church wedding?
No, manor house.
Stand at the back, I just have to mime. Right, OK. Do you think you've had a fever at all?
Hard to tell. I feel hot.
Yeah, it's pretty hot. Yeah. Not felt freezing cold, though?
No.
No, good. Have you been taking any painkillers at all?
Not yet today.
OK. So your temperature's normal, 37.2. That's good. Let's have a look in your throat then. Stick your tongue out for me. Nice big ah. So it's quite red. Your tonsils don't look... Yeah, your tonsils don't look too bad. Let's have a feel of your throat now. Is this sore?
There, yeah.
All over. Quick look in your ears. Have a stand up for me a second. Okay, turn around. Let's have a look in this one. Okay, so your ear canals are a bit red, both of them, and your eardrums look absolutely fine. So I think it's probably a viral sore throat. There's no pus on your tonsils. Your temperature's normal, which is good. With tonsillitis, there's two types, there's viral and bacterial. Viral is just really annoying, we can't do anything about it. It's just a case of just waiting and painkillers. I think just, are you off today or have you got to go to work? In work. So just a case of rest as much as you can tonight, early night, painkillers, paracetamol, ibuprofen with your food, and the throat spray if you want to get some of that from the pharmacy. Okay. Loads of water, and try and avoid alcohol tomorrow. But other than that, have a fabulous weekend.
Try to.
All right.
Thank you very much.
See you later. Bye.
There's a lovely handbag here. Take care.
Thanks very much.
Bye-bye. Thanks.
Tidy up, Father. Tidy up.
Don't worry. I'll do
Okay,
it.
thank you. Bye-bye.
Okay.
Thanks.
Bye-bye. Tidy up.
Tidy up now.
Batman? Yeah, OK, brilliant. Oh, I lost 4.5 pounds. It's slim and we're
Well done.
Don't look at the fridge now, then. No. OK, bye-bye.